My name is Jacob. I'm a 16-year-old kid who has cone rod dystrophy, and it affects my peripheral vision. In our family, driving, cars, all that is everything to us. If there's one thing that I can say that can describe either the Santiago's or the Thomas families, is it's all about the cars. Cars are everything. If you had a car, you know, your freedom. So when I found out I had an eye disease and I probably wasn't going to be able to drive, it crushed me. It took a lot of years of convincing to my parents to let me get a car. And after they did say it was okay, you know, like a symbol of hope. It's almost more respect that you get, and it helps you try to live your life more than what they tell you it's going to be.
Jacob has a condition called cone rod dystrophy, which is a genetic condition. It's very hard to diagnose. It's a condition that causes him to have problems with his central vision and also his peripheral vision. It gives him light sensitivity so that he needs to have sunglasses to be worn all the time.
A lot of times it affects the way and how you function in society, you know. People look at you differently than normal, and it can kind of cause a little bit of stress sometimes. And schoolwork and all that stuff, it gets piled up easy because you don't always have the necessary vision to complete the assignments that you were told to do. School over the years, they've helped more and more every year as they've gotten the flow of things, because as you can imagine, there's not very many visually impaired kids out walking around. So it gets hard for the school district to be able to judge what a kid needs and what he doesn't need. Thank goodness there's VI teachers, which are visually impaired teachers that help teach visually impaired students. And they can kind of provide some perspective to the school districts and all that stuff. So as of right now, I do have a paraprofessional, which is pretty much a one-on-one aide, and she helps me throughout my whole day.
Homework is a struggle. It's really hard. The strains throughout the day. Jacob's eyes, like when we look at something, we visually get it and we say, oh, that's a chair there, or oh, we read a sign, it says stop sign, we think stop. There's no work involved for it. But with Jacob, he's constantly working to see. So there's so many calculations he's doing just to be able to determine what something says. The Department of Rehabilitation representative referred us to WesternU for services to evaluate where Jacob's vision was at. Was there anything needed for Jacob to help him to be successful as a student so that he could be a functional adult and someday have a job, go to college, do everything that a normal person can do, and then contribute back to society. We met Dr. Napier, who we love. She's wonderful and great. We've also met some of the medical students there with Dr. Napier. And what they do is they do testing on Jacob's eyes, and they try to get his eyes to be able to see the best that they possibly can.
The Sight Savers of America program is a fantastic program that we've been working with for a few years. What happens is that we identify people that will meet the qualifications of the Sight Savers program, which usually means kids that have a visual impairment, and we give their names to Sight Savers. Sight Savers has a process where they determine who will be a recipient of one of their electronic video magnifiers, and then they contact us so that we can coordinate it. I'm very pleased that Jacob has been selected as part of the program for Sight Savers, as I think that he'll really benefit from the electronic video magnifier that they're providing.
The EVM, I use it a lot of time for papers that are not as big as I would like them to be, and I usually use it at nighttime when I have the least of my vision. So it really helps, and I just use it for a lot of different things that are like hobbies. I use it for that a lot. If I need to see a small screw or I need to see a small piece for a model, it just really helps me out in that area because things are smaller. I have a really nice high school ministry pastor. Since the day I got into there, he's been always trying to help me out because he knows I'm visually impaired, and reading out of a book that's very small print because they're trying to fit in a lot of words isn't exactly the easiest. So what he's done for me is he's made large print copies of the main book that we're reading out of, just so that I can be able to see it and read along with everybody else too.
It's interesting as a mom having a kid who's visually impaired because you feel every struggle even stronger. For example, if he's using a cane, a mobility cane, Sometimes people are fearful of that or don't understand it or they have questions. We also have situations where Jacob's so normal and he's still just a normal teenage boy that sometimes people don't realize he has an impairment, and they'll just think, oh, he's a normal kid and he doesn't need any extra help.
My family was always there with me every step of the way. Most eye doctor appointments, they were all there with me, you know, to really just support me in the event that they said something was wrong, or, well, eventually they said something was wrong, but they were always there no matter what. And in terms of vision loss, they just accommodate everything. They adjusted their lives and their schedules according to what I had to do.